Hey everyone, it's Michael with Stow-Kent Chiropractic. I'm here today with Olivia, and we're going to talk about what she's been dealing with and the treatment we performed for her. So what did you come into the clinic for?
I came in for lower back pain and severe menstrual cramps at the time.
Okay.
It was pretty unbearable. I was missing work because of them, nauseous, lightheaded, dizzy, everything, and I was just very uncomfortable.
So when you would have your menstrual cycle, you had a pretty low quality of life during that time?
Mm-hmm.
Okay. All right. What did you do in the past to help with that?
I've done home remedies, certain fruits, heating pads, ice pads, ibuprofen, Midol. I've gone to the gynecologist. I've tried birth control. They even suggested like pressure points, stuff like that, and I tried everything and nothing helped.
Nothing helped.
Nothing helped at all.
Okay. All right. So, wait, how many treatments did we do for this?
One.
We did one treatment.
We did one treatment.
And how did it feel while you were doing it?
It hurt while you were doing it.
Uh-huh.
It was very uncomfortable. It almost like nails were digging into my body.
Okay.
And though at the time I had a cramp anyway, so it could have just been on top of that.
Right.
But I was very uncomfortable while you did it.
Okay. So we did one treatment. How long ago? That was like 8 months ago, wasn't it?
Yeah.
Okay. How have you felt since we did that treatment 8 months ago?
Amazing, actually.
Amazing?
I still get cramps, but they're not as bad.
Okay.
And they don't last the whole time. It's usually about like the first or second day, and then after that, I don't have cramps anymore.
All right. So on a pain scale from 1 to 10, 1 being the least, 10 being the most, before we did the treatment, how did it feel?
Oh, yeah, like 8, 9.
8, 9?
4 or 5 days.
For 4 or 5 days. So we did one treatment. How did it feel since then over the last 8 months when you have your symptoms?
I'd say like 2 or 3. I can go
2 or 3?
Yeah, I can go to work. I can function around the kids fine. I'm not bending over in pain. I don't feel nauseous anymore.
Okay.
And I used to live off of ibuprofen the whole time, and I can now take like maybe 2-3 pills a day, if that.
If that.
If that.
So your pain has severely, just diminished?
Yeah.
And your NSAIDs have gone down? So you're not using that? Well, that's good, because that's not exactly good for the liver. All right. So this treatment, although it was uncomfortable, with the results you received, would you recommend it to someone else?
Oh, yeah.
Yeah?
Oh, in a heartbeat. I was coming here long before. I didn't even know that this was an option for period cramps.
Did you ever ask?
No, I
Okay.
didn't. Now, I know that when I went to like my doctors, things like that, and we went through treating options, never once did it even come up about going to a chiropractor to see about it, or doing like, it's almost like a massage for it, actually. And it was just never came up. And I would come here, but I never thought of saying anything because it had nothing to do with my back.
Okay.
And I thought that's all a chiropractor did was with the back. And then you guys told me about the migraine stuff, and then you said something about the period cramps. I was like, okay, like what do I have to lose at this point? I tried everything else, and literally left here, and it was just gone. Like I've never.
For the last 8 months?
Yeah.
One treatment?
One treatment.
All right, where did you get this treatment at?
Stow-Kent Chiropractic.
That's awesome. All right, guys, give us a call and we'll see what we can do for you.